Hey guys, it's Dr. Murphy here on my account, and I want to make some comments, right? I want to make some comments here that really make sense. I understand that hospitals are getting 75% of all testing supplies, all PPE, all testing supplies. Now, it makes sense with PPE because there are a lot of sick patients in the hospital, but it doesn't make sense with testing supplies. Do 75% of all residents reside in the hospital? And does every bed in a hospital flip over every day? No, it makes no sense. No sense at all. And I want everyone to know this. In the community is where the testing should be done. In the community, there is tenfold, 20-fold more need for testing than there is in the hospital. The numbers just don't add up. Take, for example, Greenwich or Stanford Hospital with a few hundred beds. How many residents are in Stanford, in the city of Stanford? 130,000? 140,000? Well, at least 10 to 20,000 of them need to be tested. Does the hospital have 20,000 beds? Can the hospital handle the volume of 20,000 people running to the hospital? No, it would overwhelm the hospital. That's why we sent up the centers at Cummings Beach. But if we can't get the equipment because it's going to the hospitals, we can't test. And if we can't test, we can't do the rest. Is it fair that all the towns that don't have hospitals in them don't get access to testing equipment? No, it is not. If we can't test, we can't do the rest. So I'm calling on all hospitals today. Honor the commitment to the communities you serve and serve the communities. If you don't need nasopharyngeal kits, if you aren't testing thousands of people a day, give the kits away. Give the kits to the towns that you serve. Give the kits you're not using to the towns that you serve. If they can't test, they can't treat, they can't isolate, and they can't trace. The towns have the departments of health, not the hospitals. The hospitals do not need 75% of testing kits. If the towns can't test, they can't do the rest. I'm calling all hospital CEOs. I'm talking to you, Marna. I'm talking to the team at Stanford Hospital. I'm talking to the Norwalk Hospital team. I'm talking to the Danbury New Vance team. Honor your commitment to the towns you serve. These include all the small towns that don't have hospitals that you serve. I'm calling you all out. You may need the PPE, but you don't need the nasopharyngeal kits. You don't need all those kits. If we can't test, we can't do the rest. If the towns can't test, they cannot protect their citizens. I'm calling all the hospitals out. Support the communities that have supported you. Give the towns the nasopharyngeal swabs so they can test. If they can't test, they can't do the rest, and they can't protect their town from a surge of novel coronavirus. It just makes sense. Protect the towns that you serve. That's what I'm trying to do, and I expect all of you CEOs to do the exact same. This is Dr. Murphy at coronatestct.com, Dr. Murphy at Murphy Medical Associates. If you're feeling like you have symptoms and you haven't met criteria at a hospital center, which we're seeing more and more of, go to our website, coronatestct.com, coronatestct.com. Hospitals, we're all in this together. You don't need to hoard nasopharyngeal test kits. Share them with the towns that you serve. All of you. If we don't get through this together, we are going to fall apart. It is going to be bad, and we won't flatten any curve. If the towns can't test, they can't do the rest. Have a good night. Listen to what I said. I know what I'm talking about. I can see the future. Hospital hoarding of nasopharyngeal kits and government distribution of 75% of those kits to inpatient facilities, make no sense. Please, Governor Lamont, listen to me. Towns deserve their share. Cities that don't have hospitals deserve their share. If they can't test, we can't do the rest. Protect the small towns too. Hospitals, serve the towns that have served you.